Hello everyone, let's try to solve this question together. So after performing a septic workup, a preterm infant is started on IV cloxacillin and IV cefepime based on the unit's adherence to the strict antibiotic stewardship guidelines. So based on the culture reports which are given on the right side, what do you guys think is the best management would be? Okay, what do you guys think? The correct choice here is change the antibiotics. So the point here, which we want to make here is that antibiotic stewardship is very important. So selecting a targeted therapy would be better rather than using the broader spectrum. For example, after performing a septic workup, vancomycin and zosyn could be selected, but the unit policy suggested cloxacillin and cefepime. And in this case, if you see, the urine culture is on the top and blood culture is on the bottom. So the blood culture grew Staph epi, as you guys can see here, and the urine culture was positive for E. coli, but unfortunately it's extended spectrum beta lactamase, so that's serious. And you guys can see that this is a very resistive organism, and unfortunately this is resistant to cefepime, and the Staph epidermis is resistant to oxacillin. So both the bugs are resistant to what we are using here. So that's why, cloxacillin and cefepime has to be changed. So that's why A is the right choice. Continuing with stewardship in this case is not the right thing to do because we have the sensitivity and resistive pattern. And again, this boils down to the concept that the stewardship is important, but again, you should be selecting the antibiotic based on your unit or your area antibiogram or the hospital antibiogram, because certain hospitals are very specific with certain bugs and their resistive patterns. So it's very important whenever you're developing a stewardship policy, you have to look at your own antibiogram to go with. This is a real example where following the cloxacillin and cefepime as the first line would have resulted in this baby's serious infection. So that's why you have to let go here the stewardship. What about removing the central catheter? With blood culture positive for Staph epi, the removal of the catheter is not mandatory. If it was fungal or if it was gram negative, of course the line has to come out. But with the Staph epi, if you have issues with getting a central line, it's okay to keep the central line till the blood culture become negative. But again, ideally you should remove, but it's not as emergent as in case of fungal or gram negative sepsis. Now, what about obtaining an echo and renal ultrasound? That could be a possibility, but because this is the first culture, let's treat it and see if there is no reoccurrence and the cultures are negative after changing the antibiotics. There is no need to obtain echo to look for vegetation. And renal ultrasounds for UTI, again, is debatable. Some people do the ultrasound just to see if there is any congenital anomaly. Some people hold on. Just follow the recent recommendations and whatever your unit policy is. But again, because D has a combination of echo and renal ultrasound, so that makes this option a wrong choice. And again, the answer was changing the antibiotics. So I hope you guys have learned something together. It is a very nice debatable question, but a real scenario where one has to understand the importance of antibiotic stewardship plus the advantage of choosing the right antibiotics and bypassing the stewardship in sick premature babies. So again, do like and subscribe to our channel, and you guys have a wonderful day. Bye.